Conventional. Haldol, half milligram to 5 milligrams, 2 to 3 times per day. Severe symptoms may require up to 100 milligrams per day. Thorazine, 10 to 25 milligrams, 2 to 4 times per day. May increase dose every 3 to 4 days. Usual dose is 200 milligrams per day. Stelazine, start 1 to 2 milligrams every 12 hours, 2 to 5 milligrams twice per day. Maintenance dose, 15 to 20 milligrams per day, reached within 2 to 3 weeks. Prolixin, daily maintenance dose, 1 to 5 milligrams, up to 40 milligrams per day may be necessary.
I am going to talk about the side effects for conventional antipsychotic agents such as Haldol, Thorazine, Stelazine, and Proloxin. The side effects of conventional antipsychotic agents include anticholinergic side effects, antiadrenergic side effects such as orthostatic hypotension. These medications can lower the seizure threshold and may raise prolactin levels, causing lactation. These are things that we as nurses need to be aware of in our patients who are taking conventional antipsychotic agents.
Hi everyone, I'm here to go over the special considerations for the conventional antipsychotic medications. So first we have EPS, which is also known as extrapyramidal symptoms, and I like to remember this by the acronym TAP. So we have tardive dyskinesia, which occurs after long-term treatment with antipsychotic medications. You would have uncontrolled motor movements of the tongue and the face. Next, we have akathisia, and this is extreme form of internal or external restlessness. It can be exhausting and even debilitating. After that, we have acute dystonia, which is muscle tension disorder involving the strong muscles, such as the tongue, the face, neck, and back. Lastly, we have pseudoparkinsonism, which is similar to Parkinson's disease. It can affect the person's ability to walk and also affect their speech. So with pseudoparkinsonism, you would have tremors, shuffling gait, and then the pill rolling effect. Next, over here, we have the neuroleptic malignant syndrome, and it is rare, but it's life-threatening, idiosyncratic reaction to the neuroleptic medications. Signs and symptoms are severe muscular rigidity, hyperthermia, so temperature greater than 38 degrees Celsius, and autonomic instability and changes in the LOC. Particularly with NMS, this occurs shortly after the initiation of a neuroleptic treatment or after the increase of the dose.
And I am going to be discussing the nursing implications for the conventional antipsychotic medications. So, your patients are taking this medication, they may have a possible stroke. So you will want to look for changes in their blood pressure, changes in their LOC, and with a stroke you'll want to look for left or right-sided weakness. Because this medication does have an anticholinergic effect, they will be dry. So you'll want to monitor their I&O, and this also causes a stomach upset, so you will want to have your patients take it with food. You'll also want to teach your patient to stop smoking. Smoking while taking this medication will shorten the half-life of the drug. So what that means is that the body gets rid of it much faster. So the doctors will need to increase the dosage and it would be a mess. So just have them stop smoking. You'll want to monitor the labs. You'll want to monitor for glucose, and antipsychotic medications are very hard on the liver, so you're going to want to look at those labs as well. You will want to, like most medications, check vital signs. Patients taking antipsychotic medications will be at risk for hypertension, and because it does have the anticholinergic effect of the drying, that will cause an increased blood pressure and increased heart rate. So one of the severe side effects that was talked about earlier is the neuroleptic malignant syndrome. So what was said was that the patient, a side effect normally is, like a normal side effect is increased temperature. But with this, their temperature is really, really, really high, severe. This is a 911 emergency. So they will also have cardiac changes. So you'll want to stop taking the medication right away. Stop it. And then you'll need to cool down your patient. So that is what I have for the nursing implications for the conventional drugs.
Atypical. Clozaril, 12 milligrams, 1 or 2 per day. Target dose, 300 to 400 milligrams per day. Max dose, 900 milligrams per day. Risperdal, initial dose, 2 milligrams. Titrate increments, 1 to 2 milligrams. Target dose, 4 to 8 milligrams. Effective dose, 4 to 16 milligrams. Abilify, starting target dose, 10 to 15 milligrams per day. Zyprexa, 5 to 10 milligrams initially, increase increments of 5 milligrams per day, 1 week at a time.
I'm going to talk about the side effects for atypical antipsychotic agents such as Clozaril, Risperdal, Abilify, and Zyprexa. The side effects for these antipsychotic agents include increased risk for seizures, increased risk for diabetes, significant weight gain, high lipid abnormalities, hypotension, and dizziness, as well as insomnia. These are things that we as nurses need to pay attention to and be aware of for our patients who are taking atypical antipsychotic agents.
I'm going to be talking about some of the special considerations for the atypical antipsychotic drugs, also known as the second generation neuroleptics. Agranulocytosis is an acute condition involving severe leukopenia, most commonly a deficiency in neutrophils. People with this condition are at very high risk of serious infections due to their suppressed immune system. Clozaril is the drug associated with agranulocytosis. Increased seizure activity. The second generation psychotropic drugs pose a higher risk for seizures than the first generation drugs do. Clozaril and Zyprexa are associated with increased incidence of seizure, mainly when they are given at higher doses. EKG changes and prolonged QT interval. Long QT interval is a heart rhythm condition that can potentially cause fast, chaotic heartbeats. These rapid heartbeats may trigger a sudden fainting spell or seizure. In some cases, the heart can beat erratically for so long that it causes sudden death. Clozaril is the drug associated with prolonged QT interval. Elevated prolactin level. Prolactin is a protein that in humans is best known for its role in enabling females to produce milk. However, it is influential over a large number of physical functions. Prolactin plays an essential role in metabolism, the regulation of the immune system, and pancreatic development. Risperdal increases prolactin in both men and women. Metabolic syndrome. Metabolic syndrome is a cluster of conditions including increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. These occur together, increasing the risk of heart disease, stroke, and diabetes. Metabolic syndrome is a leading cause of morbidity and mortality in patients with schizophrenia, with a prevalence rate double that of non-psychiatric populations. Given the amount of evidence suggesting a link between atypical antipsychotic medications and metabolic syndrome, several agencies have recommended regular clinical monitoring of weight, symptoms of hyperglycemia, and glucose in chronically medicated patients with schizophrenia. Abilify is the only atypical antipsychotic that does not pose a serious risk for metabolic syndrome.
Okay, I'm going to be discussing the nursing implications for patients taking the antipsychotic medications that are the atypical. The atypical medications have less side effects, so you will have less nursing implications with them. But you will want to control the blood sugar. Taking this medication, their blood sugar may increase, so you'll want to look for early signs. You're going to want to do your 3 Ps, your polyuria, polyphagia, and polydipsia. Okay? Your patient, you'll want to teach your patient that they may have weight gain, and they may have increased heart rate, increased blood pressure, which will put them at risk for hypertension. Another thing is you're going to want to let the patient know about the orthostatic hypotension changes. So when they get up, they might get dizzy, so they need to get up very slowly, and you'll want to monitor their blood pressure from lying down, sitting, and standing. There's not much here that for the nursing implications, but the last thing is that you do not want to give any of these medications with dementia patients or Parkinson patients. Okay, thank you.